what we are facing really is a paralysis of our healthcare system just over the horizon, because right now the system of payment for that healthcare system has been crippled by a breach. It is difficult to exaggerate how important this failure by Change Healthcare is.
We are in a crisis. And in a crisis, just like we were in COVID, we're providing care because that's what we absolutely must do. That's our fundamental mission. In the immediate aftermath of the attack, hospitals and providers across the state did the responsible thing, which was make sure that patients continue to get care and that patient privacy is protected. And so what you saw was our hospitals providing all of the care that they normally would without all of the administrative processes that normally go into authorizing that care with commercial health insurance payers. It is essential that hospitals have the cash flow that not only can allow them to continue to provide patient care, but to deal with the aftermath of what will be a very long tail in this saga. On the back end, we're going to have to make sure that we are working together to clean this up so that patients aren't being confused about bills that they're getting, about services that they were provided. There is an enormity of complexity here that we're going to have to deal with over the next couple of weeks.
Right now, patients are not experiencing difficulty, right? They're getting in, they're seeing their providers. But what's happening on the back end is providers are seeking authorizations and told, you don't need an authorization for that service. The patient goes and gets that service, and then they get a denial of the claim, basically saying that you need an authorization for that service because the systems aren't talking together. We don't know the full scope of this impact. We haven't talked at all about patient privacy and what data was actually captured. By the time we reconcile this, it'll be 2-3 years down the road, and we'll find that this has been extremely devastating.
The hospitals and independent physicians and advanced care providers are doing herculean work to make the system continue functioning through manual communication and paper records to provide the kind of backup that will simply enable care to be provided. We're very fortunate in Connecticut to have really great hospitals, really great providers, really great doctors and physician practices. We can't take it for granted.